This is a hugely complex area. The cardiovascular system comprises of the heart, the blood, and the blood vessels, which we will look at individually before linking them back up. This topic is covered in Unit 1, Section 8 of your manuals. We will start with the blood, the transport vehicle of the system. Blood comprises a series of components with individual responsibilities. The first of these, and what gives blood its red colour, are erythrocytes, or red blood cells. These are disc-shaped cells with the responsibility of carrying oxygen to the body for respiration, while removing the waste product, carbon dioxide. In order for them to do this, they contain a substance called haemoglobin. The heme group of this substance contains iron, and it is this component that is responsible for the transport of oxygen and carbon dioxide, hence the red colour, and oxygen can bind to this in order to be transported. The second blood component of note are the lymphocytes, or white blood cells. There are several types of these that function in a slightly different way. However, in essence, their function is to fight infection. They are produced and stored in various places throughout the body, including the thymus, spleen, bone marrow and lymph glands, ready to be released into the blood and transported to the site of infection once said infection is detected by the helper cells. Thrombocytes are another element of blood, more commonly referred to as platelets. These are dead cell fragments. Doesn't sound particularly useful, but they are actually clotting agents. If you have a cut, it is these cells that stick together to plug the hole. The final component of blood is the plasma. This is the fluid component. It consists of around 91% water, within which can be dissolved various water-soluble nutrients for transport around the body. All the other blood components are suspended within the plasma and transported alongside other structures, including hormones and nutrients. In order to transport the blood around the body, there is a network of specialised vessels. Each vessel type has a series of properties that adapt it for its function. The first of these are arteries. Arteries take blood away from the heart. A equals away. It doesn't matter whether they are taking blood to the lungs or the body, they always take blood away. Blood leaving the heart is ejected under very high forces, meaning that arteries carry blood under high pressure. In order to facilitate this, they have very thick and elastic, smooth, muscle-layered walls. This prevents them from damage and facilitates the high pressure as the vessels are able to expand and rebound. These arteries then branch into slightly smaller vessels to reach different areas of the body. We refer to these as arterioles. They are similarly adapted to the arteries. Once in the tissues, these arterioles branch further into capillaries. These are very small vessels found in and around all the cells and are able to release nutrients and oxygen very close to any requiring tissues. As they are so thin, just one cell, they facilitate easy transfer by diffusion of nutrients to the cells. Once the blood has passed through these capillaries, the pressure is significantly reduced. As it leaves the capillaries, blood enters vessels called venules, which feed into larger vessels called veins. These have much thinner, less elastic, smooth muscle walls, as they are transferring blood at low pressures. These veins are responsible for returning blood to the heart. However, as the blood is now under low pressure, they're going to need some assistance. All veins have non-return valves along their length. This maintains flow towards the heart, as it will prevent backflow. This is particularly relevant to massage therapists, as if you massage away from the heart, you can damage these structures. In addition, peristalsis of the smooth muscle wall will be continuous and will effectively massage blood to maintain flow. Further to these specific adaptations, skeletal muscle contraction will effectively pump blood through the veins by exerting pressure on the walls. It is for this reason in particular that blood pooling can occur. This is where, after exercise, activity ceases, but the heart is still beating quickly and therefore pumping blood at a high rate. As activity has stopped, venous return may be compromised, resulting in blood pooling in the extremities and a reduced return to the heart. This causes faintness, dizziness, and nausea. If you ever suspect at a post-event treatment that someone is suffering from this, do not treat them. Get them to see a medical professional first. The final method of venous return is gravity, where the veins are above the heart. This also explains the advice to raise a limb above the heart if you have a significant bleeding wound, as it will increase the flow of blood away from the area. The heart is the pump of the system. It is therefore responsible for moving nutrients and oxygen around the body and the bloodstream. The heart itself is a small and powerful muscle. It comprises layers of cardiac muscle, unique in that they don't fatigue, and it works completely automatically, controlled by the autonomic nervous system. The most superficial of the heart layers is the pericardium. This is a protective sac that surrounds the heart. Within this sits the myocardium. This is the main layer of cardiac muscle from where contraction is completed. The innermost lining of the heart, the endocardium, is made up of a combination of connective and epithelial tissue. This gives the fist-sized organ a very strong basis. So how does it work? The heart itself is divided into two halves by a fibrous septum. The right side receives blood from the body and returns it to the lungs. The left side does the opposite and receives oxygenated blood from the lungs and sends it to the body. Within these two halves there are 4 chambers, 2 atria and 2 ventricles. The atria are the top chambers, the entrance to the heart. They receive blood from veins under low pressure. The ventricles are the lower chambers of the heart, from where blood can be pumped to the body or the lungs. Valves maintain the direction of blood flow, especially during contraction, separating each chamber and the blood vessels. There are semi-lunar valves between the ventricles and the arteries, and between the atria and the ventricles there are bicuspid or tricuspid valves. Bicuspid on the right side, tricuspid on the left. Blood enters the left atria via the pulmonary vein. This is carrying oxygenated blood from the lungs under low pressure. The blood then starts to flow passively into the left ventricle. This flow of blood is then completed by contraction of the atria. At this point, the left ventricle will contract. This causes the valves between the two chambers to be forced shut. This is what you hear when you are listening to a heartbeat. Rather than a contraction, it is the valves slamming shut. This high velocity contraction forces the blood out of the left ventricle into the aorta, where blood can be carried to the rest of the body. The left ventricle is typically larger and stronger as it has to send blood over a very large distance. At this point, all the oxygen and nutrients can be utilised by tissues, and therefore we now describe the blood as deoxygenated. In reality, this process is not 100% efficient, and therefore there will still be a degree of oxygen saturation in the red blood cells on return to the heart. As this blood returns to the heart via veins, it will come into larger vessels. The largest of these is the vena cava. You have a superior and inferior branch that return blood to the right atria. What we have just described is the systemic circuit, providing blood to the body. The same process as in the left now happens in the right heart chambers, i.e. the blood flows through the atria to the ventricle before contraction occurs. However, from the right side of the heart, we are sending deoxygenated blood via the pulmonary artery to the lungs. This is the only artery that carries deoxygenated blood. Here they are able to restock on oxygen before returning to the heart via the pulmonary vein with oxygen-rich blood. This is the pulmonary circuit. So now we're back at the beginning. These heart contractions are electrically stimulated from the bottom of the heart, controlled by the sinoatrial node. This is a natural pacemaker that is controlled by the autonomic branch of the nervous system to quicken or slow, depending on the level of stress the receiving tissues are under. The final factor to consider is the role of blood pressure. This is a measure of the pressure exerted to the walls of the arteries during a contraction and relaxation of the heart. It is measured in millimeters of mercury and recorded as systolic over diastolic. What? Systolic pressure is a measure of the amount of pressure during a contraction of the heart, while diastolic is a measure when the heart is relaxed. It is influenced by the rate and strength of the heart contraction, but also by peripheral resistance. This is how much resistance is offered by the blood vessels to the flow of blood. Typically, a healthy blood vessel will offer very little resistance, will be elastic, and therefore facilitate the flow of blood. However, should there be any fatty deposits or plaques, damage or reduction in elasticity, this resistance will increase, and so will blood pressure. Too low a blood pressure and you may faint. Too high and you risk cardiovascular disease. Optimal is described as 120 over 80, with ranges above and below this reflective of a person's health. Someone very fit will often be perfectly healthy, but have very low resistance and a very efficient heart, and therefore theirs may be lower. Blood pressure over 140 over 90 is described as hypertensive or high blood pressure. You should be very careful when working with someone who has high blood pressure for risk of enhancing symptoms and causing problems with plaque disturbance. Blood pressure is changeable both long and short term. For example, exercise will increase blood pressure on a short-term basis in order to supply oxygen as the heart beats faster, increasing cardiac output. Further to this, it can be influenced by factors including diet, activity levels, weight, genetics, and family history. Massage is also a huge blood pressure influencing factor. Through massage, you should be looking to relax your client, decreasing their stress levels and therefore decreasing their blood pressure through stimulation of the parasympathetic nervous system. For this reason, you must be super careful when someone stands up. They may be very dizzy. If, however, your treatment is too intense, you may elicit a sympathetic nervous response, increasing heart rate and therefore creating a stress response. This will have a negative impact on the effect of your massage. There is a very fine line here. So to summarise, the cardiovascular system is a transport network for oxygen and nutrients in order to supply the body. It is, as a result, integrally linked to the respiratory system, which brings the required oxygen into the body. This is your next section, so please complete the questions and then move on to the respiratory system. This section does appear in the exam in some detail, so please refer to your manual or email any queries if you're unsure.